Welcome to the OR Setup Guide. Today, we're walking through the protocols for managing surgical sponges during major abdominal operations. The primary tool we rely on for deep tissue procedures is the Promed X-ray Detectable Abdominal Pack, manufactured by Cotton Craft Private Limited. During a laparotomy, these packs are deployed to rapidly control internal bleeding and gently pack away organs to maintain a clear line of sight. Our objective is total patient safety through 100% accountability, ensuring zero surgical sponges are ever left behind. Success depends on the surgical team's strict adherence to inspection and tracking protocols, starting before the patient enters the room. Step 1 begins with the circulator nurse assessing the specific procedure's needs and selecting the correctly sized pack, typically the standard 30 by 30 centimeter option. Depending on your hospital's specific sterilization workflow, you may pull these from clear, bulk packaging meant for non-sterile pads, or you will use the individual sterile pouch option. When handling the pre-sterilized packs, we have to conduct strict integrity checks. First, verify the expiration date printed directly on the label. Then, physically trace the perimeter of the pouch with your fingers to ensure the seal is completely intact, with no micro tears. These packs must remain in a cool, dry storage area. Inspect the outer packaging closely for any condensation, water spots, or signs of moisture intrusion. If you find a compromised seal or any moisture damage, discard the pack immediately. Introducing it would compromise the sterile field before the first incision is even made. Once the package passes inspection, peel back the sterile wrapper and cleanly drop the sponge onto the sterile tray. Ensure your non-sterile hands never cross the plane of the sterile field. Immediately after the drop, the scrub nurse and the circulator must conduct a baseline initial sponge count together, speaking the numbers aloud. Before counting it as valid, the scrub nurse will completely unfurl the BP Type 2 woven cotton fabric to inspect the internal structure. The most critical feature you must verify is this: the non-toxic radio-opaque strip securely sewn into the corner of the pad. While checking the strip, also verify that the reinforced edges and secure stitching around the perimeter are completely intact and free of fraying. Establishing an accurate initial count and physically confirming that every single sponge has its X-ray detectable strip creates the mathematical foundation you need to track everything safely during the operation. Now that the count is logged, the sponge is ready for intraoperative deployment. When the surgeon requests a laparotomy sponge, pass it securely to the field. This diagram illustrates why we use BP Type 2 cloth for major procedures. The dense woven fibers quickly soak up and retain massive volumes of bodily fluids, far outperforming standard loose gauze. Beyond absorption, these pads are placed internally to gently pack away organs, securing a perfectly clear surgical field for the team. Because they sit directly against internal tissues, the 100% natural cotton construction is essential. The material is chemically inert and soft, preventing tissue irritation or allergic reactions while packed inside the patient. Even when fully saturated over a long case, the secure stitching allows the pad to hold together without tearing or leaving shredded fibers behind. These engineered physical properties allow the surgical team to aggressively control the operative environment without risking material breakdown or contamination. As the procedure wraps up and the team prepares to close the surgical site, we enter the final accounting phase. The circulator and scrub nurse conduct a rigorous final sponge count. To ensure visibility, used sponges are typically hung individually on a sponge tree or rack, matching them exactly against the initial baseline. If that final count does not match the starting number, or if hospital policy mandates automatic verification, the team immediately pauses the closure process. This is where the built-in radio-opaque strip serves as your ultimate fail-safe against human counting errors. The team brings in a portable machine to take an abdominal X-ray. As you see in this scan, the embedded strip appears as a bright, unmistakable line, pinpointing the missing sponge. This radio-opaque technology ensures that counting discrepancies are resolved instantly, definitively preventing a retained foreign object from harming the patient post-surgery. Safe surgical packing relies on 3 non-negotiable pillars: strict package seal inspection, rigorous team counting, and final X-ray verification. To consistently execute this protocol, we rely on the Promed product line, which is designed specifically to meet these stringent requirements. The BP Type 2 cotton construction ensures high fluid absorption and maintains clear surgical fields throughout the entire procedure. By combining disciplined tracking protocols with properly engineered surgical tools, the OR staff can focus entirely on delivering a successful and 100% safe patient outcome.